The Department of Foreign Affairs and Trade has upgraded its travel advice for China to the highest level, advising travellers not to visit the country as the coronavirus outbreak takes hold. Joining us live now is Dr Harry Nespolon from the Royal Australian College of GPs. Doctor, is this a good move?
Yes, absolutely. I think the two aspects that were announced yesterday, which was the do not travel to China warning, and also the fact that non-Australian citizens will now not be able to come to Australia, will help to decrease the number of potential cases here in Australia.
You've also asked or called for GPs to be given masks?
Yeah, so the government has acquiesced to that. Earlier on this week, they took 1 million masks out of our $12 million mask store and have already started to distribute them, and we've certainly been getting them on the ground at the moment.
Just on that, which masks work and which ones don't? Because you see a lot of people wearing masks of all shapes and sizes and colours.
Look, the answer is that it depends. So that if you're at a low risk, straight surgical masks are okay if you're in a low risk situation, but if you are in a situation where you do have someone who potentially really is at high risk of the coronavirus, then the N95, the P2 masks are the ones that you should be wearing.
There has been a lot of misinformation head out on social media, and it becomes difficult when you have issues like this and they go worldwide. What is your advice to everyday Australians living their lives? Well,
I think the advice is that, first of all, don't panic. We're still very low risk here in Australia. We've only had, I think, 12 cases so far. And so from that point of view, we need to just sort of keep it in some sort of perspective. But having said that, the government, in my view, is doing the right thing in making sure that we're getting less potential cases coming to Australia, and that hopefully we will find that in the next couple of weeks, next 4 to 6 weeks, that this crisis will actually begin to abate a little bit. So for the average Australian, the government is trying to do the right thing to allow us to go around and work and live normally without fear of getting a potentially lethal virus. And so we need to keep doing what we're doing at the moment, which is to keep an eye on what's going on and increase our surveillance and increase our protection measures as time goes on.
From your position as a medical professional, do you think the government's done a decent job?
I think the government has done a decent job. It's easy to criticise in retrospect. Information is literally coming out hourly, daily. Overnight, we've had another 2,000 people diagnosed with the virus, and you would think, on the face of it, that that's probably is about time that we do stop people coming from high-risk areas, which is now China. About 40% of the cases occur outside of the Hubei province, and so temporarily suspending flights from China, or allowing people to come in from China, should I say, is a good idea. And yes, the government is doing the best that they can.
Have we learnt much from the SARS outbreak from years ago?
Yes, we've learnt a lot from the SARS outbreak from years ago. It is the same sort of virus that caused the problem. I think there were only about 300 deaths. Unfortunately, I shouldn't just say only. There were 300 deaths from SARS. We're up to almost 300 now in China, which is incredibly unfortunate, and we've still got a way to go. So it has provided a basis, but we're learning all the time at the moment.
No doubt a lot of the deaths would be the more vulnerable in society as well, you'd think.
We've also got to remember that it is the peak flu season in China and in Northern Europe. I think there's been about 20,000 deaths from the flu, if you want to put the coronavirus in a sort of perspective in China. The difference being that we do have some ways of treating the flu virus. But yes, generally people who have other medical problems are the ones that are most susceptible to, unfortunately, dying from these viruses.
Some of the brilliant research work being done is being done right here in Australia with Queensland University. We hear that a vaccine could be around a year away. Do you think we'll need one by then?
Look, there's varying timelines for the vaccine. I've certainly read less than 6 months. The SARS virus, following on from your previous question, helped set up the Queensland Institute, which is there to develop vaccinations as quickly as they can so that they can be used. Look, hopefully if it does take a year to develop a virus, that it will be long gone and hopefully almost forgotten by then. But look, the sooner we can get a vaccination, which is really the best way to deal with this, the better for everyone.
Dr Harry, great to talk to you this morning.
Great to talk to you.